A thin 72 years old lady has a 3 weeks history of postprandial abdominal pain. So 3 weeks history of the postprandial abdominal pain that is centrally located, and she has episodes of diarrhea and occasionally has passed blood per rectum. She has history of ischemic heart disease and marked renal impairment from the angiotensin converting enzyme inhibitor uses. What is the most likely appropriate investigation? So let's see the key points in this question. First of all, 3 weeks history of the postprandial pain, which is centrally located, and she has episode of diarrhea and occasional passage of parectal bleeding. So when there is history of the postprandial abdominal pain and diarrhea, it goes in favor of mesenteric ischemia. It goes in favor of mesenteric ischemia, and it is centrally located. That means it is originated from the small intestine. Now see, she had history of the ischemic heart disease. So she had a history of the ischemic heart disease and renal impairment due to ACE inhibitor. So what may be our investigation? Here the options are colonoscopy, duplex ultrasound scan of the abdomen, CT angiogram, CT scan with contrast, measurement of the fecal calprotectin. So what may be the answer? So let's see. So first of all, this is showing a so this is showing a CT angiogram. Here we can see the CT angiogram, and in the CT angiogram there is showing the different type of the blood vessel, and the CT angiogram is the best or gold standard for the abdominal blood vessel analysis. Here the clinical symptom, which is the postprandial abdominal pain and also the postprandial diarrhea, it denotes there is a vascular pathology. So for vascular pathology, CT angiogram is the best investigation. But let's say there is alternative, which is the ultrasonogram, or it is the duplex ultrasound. This special type of ultrasonogram is known as the duplex ultrasound, and in the duplex ultrasound we can see the different type of the blood vessel, the different types of the artery, different type of the vein in the abdomen. So let's see, she is likely have mesenteric vascular disease, as there is a postprandial abdominal pain and there is postprandial diarrhea. So these two important clinical feature is enough that this is a mesenteric vascular disease. The proximal superior mesenteric artery disease would be the most serious variant, and it is the most common, and it supplies the small intestine. As it supplies the small intestine, so the most common abdominal pain is centrally placed. CT angiogram is the best. CT angiogram is the best option. But here we can see this patient suffering from but with the impairment of the renal function. But when there is renal function or kidney disease and low BMI, make a duplex scan of the superior mesenteric artery. So when there is a significant kidney function loss, or when there is low BMI, that means when there is less body fat and there is less fat content in the intestinal mesentery. So it is easily seen by the ultrasound, and also when there is the less renal function. Gut peristalsis may impair acquisition of the magnetic resonance imaging. We know this is true. So relevant of the case, first of all, the elderly lady with vascular disease and ischemic heart disease. So it is suspected that it is mesenteric ischemia, and she also have generalized atherosclerosis as she is elderly, and ACE inhibitor, it contributes to renal impairment, and in case of the renal impairment we cannot use CT angiogram, because in CT angiogram we use dye, so dye is not used. So what is our answer option? Our answer option is the duplex ultrasound scan of the abdomen. And other options here, such as, and why duplex ultrasound? First of all, the patient is thin patient. Second of all, there is a significant renal impairment. So if there is no renal impairment, we could go through the CT angiogram, which is the gold standard. But as the patient has the renal impairment and thin patient, we can go through the duplex ultrasound. Other options here, such as the colonoscopy. The colonoscopy, it can find the bleeding or source of bleeding, or a site of the bleeding. Actually, it is the site of the bleeding. But at the same time, we have to keep in mind that the colonoscopy, it can see up to the cecum, and some part of terminal ileum, and some part of the terminal ileum. It may be said that 10 to 20 centimeter of terminal ileum, but this clinical picture, it shows centrally placed. That means it is most likely due to intestinal, small intestinal origin. So in colonoscopy, it may be missed, because in colonoscopy we can find the site of the bleeding, but sometimes it is difficult to say the exact origin. Then CT angiogram is not compatible with this patient. Why? Because the patient is kidney failure. The patient suffering from kidney failure, and CT scan without contrast. Actually, without contrast, there is no benefit, because we have to see the vascular compartment. So to see the vascular compartment, we have to give dye. As without contrast, this image is invaluable regarding the vascular anatomy, regarding the vascular anatomy, vascular pathology or vascular condition. It is useless. And measurement of the fecal calprotectin, we know the fecal calprotectin, it increase in case of the inflammatory bowel disease. So, and as it is a vascular disease, not inflammatory disease, so fecal calprotectin cannot help to diagnose this condition. Thank you.